everyone. So nice to see you again. And today I want to talk to you a little bit about medication-assisted treatment for other substances like marijuana, cocaine, and methamphetamine. So unfortunately, unlike medication-assisted treatment for nicotine, alcohol, and opioids like we talked about in previous talks, there aren't as many evidence-based medications for the treatment of marijuana, cocaine, and methamphetamines. But there are a few medications that have been used and have some small evidence, and anecdotally, some of my patients feel like they're really helpful. So, starting with marijuana, marijuana addiction is real, and it's got a withdrawal syndrome just like all the other substances of abuse. And one of the few medications that's thought to be helpful to help with marijuana cravings is something called N-acetylcysteine. It's a vitamin that you take twice a day that can help alter thoughts around marijuana. It's also a brain vitamin and has very little side effects, so there's lots of reasons that it can be helpful. Also, engaging in cardiovascular exercise about 30 minutes a couple times a week has been shown to help reduce marijuana cravings. For cocaine use disorders, unfortunately, we have very little evidence that there's a lot of medications that help, but there is one medication called baclofen that a German physician who was struggling with cocaine use disorder himself and had known about the evidence around using baclofen for alcohol use disorders, decided to try it on himself and found it to be very helpful. So baclofen is one of the only medications that I will prescribe for patients who struggle with cocaine use disorders. But there is some promise around advancing technology called TMS, or transcranial magnetic stimulation. There's some good data coming out of Italy that it may be something that could be helpful for cocaine use disorders. Finally, for methamphetamine use disorders, mirtazapine or Remeron is a medication that's recently been shown to be somewhat helpful for reducing methamphetamine cravings. And then there's very limited evidence, but again, some of my patients find Wellbutrin or bupropion has been really helpful to control their cravings to use methamphetamines. I'm hopeful that in the future, as technology and medications evolve, there'll be more medications that will be helpful for each of these substance use disorders. But in the meantime, if you have one of them and you're struggling, you should consider talking to an addiction specialist about how any one of these may be helpful to you. Be well.